Hello everyone, please contact Professor Robert for a sample or a customized paper of the following or any other assignment. NUR1110. Communication and Scholarship in Nursing and Midwifery. Written reflection. Description. The description is the first step of the Gibbs cycle that explains what happened. This puts the readers in the picture of the developing story or the event that developed the situation that led to personal reflection. Haten, 2014. I found myself lying in a hospital bed in a foreign country that seems like India. As I was traveling alone, my body started feeling uneasy. This feeling developed into serious issues, and my visual and auditory ability became unstable to the point that I was transferred to a local hospital. At this hospital, I found myself surrounded by nurses who did not introduce themselves, and were even speaking in a foreign language that I did not understand. My eyesight were blurry, so was the hearing, but from a distance I was able to see that the curtains were open, and other patients were just looking at me. This made me uneasy because of the lack of privacy, and as a result I started texting someone asking him where he was, and telling him that I was scared. Overview. This unit introduces learners to the process of self-reflection, clinical communication, questioning and critical thinking in preparation for problem recognition, problem solving and maintaining personal well-being. Research, academic writing skills and knowledge of evidence-based professional practice equip the learner as a scholar and a nurse midwife. The concepts of person-centeredness, nursing, and woman-centeredness, midwifery, are explored from the perspective of self, examining personal values, sets of beliefs, cultural perspectives, attitudes toward others, and factors that influence health across the lifespan. Assessment. Written reflection. Reflection and critical thinking are integral skills for professional nurses and midwives to develop. 4. Assessment Task 4. You are asked to demonstrate your development as a reflective learner by discussing reflection and critical thinking supported by scholarly references and applying your knowledge to a learning experience. In week 9, 10 or 11, you will be involved in an e-simulation exercise which may not have exposed you to an experience you have never had before. In the simulation you were asked to suspend judgment and just be in the experience. For this exercise, you are asked to deeply reflect on your experience of the simulation as if it had been an actual, rather than a simulated experience. If you had really been in that situation, how would you reflect on the learning from that experience? The simulation will bring together learning from a number of your core units, so that you can reflect on the communication, cultural and other aspects of the experience, and how the experience may help to inform your future practice as a health professional. You are required to use the Gibbs Reflective Cycle, 1988, as the framework from which to write your reflective assessment piece. Below is a representation of the six stages in the cycle. We were introduced to this model in week 2, and will be revising the model in workshops before the assessment due date. Thanks for watching.